Hey everyone, my name is Dr. Jaeger and I'm a plastic and reconstructive surgeon at Victoriakliniken, and with me is...
I'm Charles Randquist and I'm also a plastic surgeon here at the Victoriakliniken, and both of us are quite excited hosting this event. I think what you'll see will challenge everything that you thought you knew about breast augmentation and enhancement. This is going to be very, very different to anything else that you have read or experienced before. Tissue preservation is an absolutely new dogmatic shift on how to perform breast surgeries, but also for you as patient to have a procedure done under local anesthesia with much faster recovery compared to anything else. And with that said, you'll be experiencing you'll experience testimonials, you'll be able to ask questions, and Maria and I will share some of our experience and knowledge during this event. So I'm really thrilled, and this is our first event, and with that said, welcome.
So let's go back to the roots of tissue preservation. Charles, how did it all started?
You know, 20 years ago I was quite active in Southeast Asia, and what I recognized was that basically for every regular breast augmentation patient there were 10 injectables into the breast. And I couldn't understand why, really, because it was the same cost and it wasn't forever. It would last for like 1-2 years, so why? And the reason was very simple. Most of these women, they wanted two things. They wanted safety, and they wanted a fast recovery and under local anesthesia. Fascinating, huh? This is the new world order. What you just saw, having a patient awake, communicating, being part of the whole procedure, on the local, walking in, she walks out. So with that understood, I just started thinking we need to change this concept, the way we do breast augmentation. We need to incorporate a concept that fits the modern woman, where she can go back to her family and her kids and her work and her sport activities much faster.
Absolutely, and I totally agree. I think women of today, they have children, they work, they're socially active, they do sports, and they cannot have like 6 weeks no sports or 12 weeks even no upper body sport. I really think this is beautiful, and when tissue preservation came to Victoriakliniken, we started doing our first case actually in 2021. Then we started as 4 surgeons, 2 centers to collect all our data, and now 4 years after, we see that we have amazing results and very safe results. And I think as a female plastic surgeon, I can just say that this is a beautiful experience also to talk with the patients during the surgery, because they do it in local anesthesia. They walk in, they walk out, and they can immediately return to their busy lives and within 3 weeks to sports. And this is a beautiful change for us surgeons as well.
We're interacting so much more, and I remember developing the tools and the technique with establishment labs. We had this vision, this idea, and then together with an amazing group of other plastic surgeons, the surgery was developed. And when we started doing this under local anesthesia, there's been a transition from what we used to do, which was, sorry to say, secondary surgeries mainly. Today, 95% of our surgeries are performed under local anesthesia with the patients awake, with this concept of tissue preservation that we've been pursuing now for 5 years. So it's been a dramatic change for our practice and for our patients. And the curve, and I know you presented at the last meeting, it's just amazing. Patients come to our practice, say, I want to have this procedure, the procedure that you do under local anesthesia. I want to walk in and out, and I want to get back to sports within 2-3 weeks. So it is a success in every aspect. However, lots of questions. How has it been regarding pain? 10 being extremely painful, 1 not painful.
I would say 1.
So I founded Victoriakliniken 25 years ago, and it's a 24-bed facility with 3 ORs. And for the longest, I was by myself. I was training surgeons from all over the world, joining me for proctorships and preceptorships and traveling around. 10 years ago, I got a younger associate, Jessica Gam, and how many years ago did you join me?
6.
and why?
I did actually a fellowship with you because I met Charles at a conference in Milano and I really loved his approach. I think it was very simple. He calls it KISS, keep it simple and safe, and I really thought that he represented this. I loved his aesthetic view of the breast and his before and after results, and so I approached him after the conference and asked if he's taking fellows, and he said yes, gave me his card, and then 1 year later I went to him.
And I'll be very, very honest, I couldn't wish for a smarter, more clever and more passionate, empathic, younger associate than Marie. I've had more than 1,600 plastic surgeons go through different type of trainings, and you're actually the only one I offered a position. And you moved here with your family, which is quite amazing. And today, Marie and Jessica are sharing this philosophy and spreading it around the world. And I think we really care about our patients.
Yeah, and I think we're a really good team. I love that about the three of us, that we work as a team and not as three individuals.
Yeah, and with that concept, we've been able to develop within tissue preservation concepts that are really new. For instance, the discussion about antibiotics, which has been essential because we all fear capsule formation and infections, but within our team we decided, also as part of the FDA study, not to incorporate antibiotics during the surgery with flushing or afterwards. And for a patient, is that important? Absolutely yes.
Yeah, because research shows that if patients take antibiotics, that it can take up to 2 years until their bowel recovers from this prophylactic antibiotics. And Jessica actually wrote a very powerful article about it, and this is when we stopped giving antibiotics post-operatively.
Yeah.
And I think it was a great decision.
Because today we all know that diseases, whether it's light inflammations or chronic or cancers, are due to inflammations, and we destroy the gut system, we destroy it with antibiotics, and by preserving that, that's really moving forward to women's health, not just the breast, but in general.
Body Image actually published a study in 2020, and they asked 18,000 women how they feel about their breasts. And actually almost 50% answered that they are not satisfied with their breasts, that they desire to have them a little bit larger. So you wonder, why wouldn't these women undergo primary breast augmentation? And the answer is very clear. Market research answered that women fear the unnatural look, the fear of general anesthesia, of not waking up after the surgery, scars, because scars actually matter for surgeries.
Absolutely.
Then the complications that are associated with breast surgery.
1 out of 3 has a reoperation within 10 years.
And therefore, actually, it's completely understandable that women wouldn't do that. But what is so beautiful about tissue preservation, that it essentially answers these questions for the first time now in a long time. And it offers the possibility to get very natural results. Patients can perform this procedure in local anesthesia, immediately go home with a very short recovery. Minimal scars, either hidden in the armpit or below the
2 centimeters.
Of 2.5 centimeter. Yeah. And I think this is the big game changer.
It is. And the interesting thing is that study covered 40 nations, 60 sites. So it's not just something that's European or American, it's women all over the world. Now, of course, there are women who want to have big breasts with big implants, but they are a minority. I mean, basically what we're talking about as a game changer is that we're able to provide a safe, reproducible procedure, enabling women to throw away their push-up bra. Because this is, in general, a small enhancement. And we've got 2 different types of procedures to meet those expectations. Either, like you said, through the axilla or through the IMF. And I call this the big 5, and the 2 most important ones are the ones you pointed out: local anesthesia and fast recovery. So it is totally changing, and the important thing is we're today able to meet those expectations or desires for these women. And we've been pursuing this now for many years, and we say it's like an avalanche. Now it's starting, and now I do believe springtime it's going to be launched in the States. The concept of tissue preservation, it's already in Europe, it's parts of Asia. So yeah, it's exciting times.
And the game changer, I think, for women in this world.
Going back to sports, no pain. You can't change this. This is going to be the future.
Hey everyone, we thought it might be interesting for you guys to understand what kinds of tools we are using for the Mia harmonization or the Preservé enhancement, and that's why we wanted to guide you through it step by step. So here are the tools. We start with a local anesthesia, and then we create a little channel that gives space for the balloon, that makes a blunt pocket that creates a blunt space for the implant that we are then going to inject. So let's go through it step by step, please.
The patient is on the table, she's awake. I talk to her, we talk to her. I do the local infiltration. This is basically the only thing that you'll feel. It's when I'm injecting the local. And then this is followed up by some more local into the channel, and there's a drawing on your breast prior to surgery, and we follow that drawing. And then finally what we do is that we infiltrate under the breast, on top of your muscle, we infiltrate the fluid. And this totally numbs the breast, so you don't feel anything. Once that's done, I get a channel separator, and through the small incision, and we're talking about 2 to 2.5 centimeter, hidden in the highest point of the axilla, we go in with the channel separator, and this is a tool that blunt, not sharply, goes under the gland, on top of the muscle, creates the channel. Once that's done, we insert the balloon through this channel, and this tool is specifically designed for the implants that we're using. And once it's in place, I lock it down with my fingers, and I talk to you, and I tell my assistant to fill the balloon on the first side, and that is then filled. And then I've created a channel on the other side. I do exactly the same thing. And what's beautiful with this is the first balloon here creates an environment where there's less bleeding. So we fill this up. And once that's done, I release the air, goes out. I remove the balloon, take it out.
And then what we do is, and this is actually beautiful for everyone that loves tech a little bit. So what we do is that first of all, these small implants, the Mia implants, that have not an anterior and posterior side, they are biconvex, so they look like little diamonds. First step is that we suck it into this injector that allows to insert these implants through the small incisions that Charles just mentioned. So first of all, I suck in the implant into my injector. And then I give this tool to the surgeon, and now have a look what is happening.
And this is so cool. Like Marie just said, it doesn't have a front or a back. So when you put it into a pocket, small incision, there's always a risk for an implant to flip. We don't like the flipping. So this implant, regardless of if it's front or back, it doesn't matter. It will give the same shape. So what we then do is we go through the channel in to this space where we want the balloon, and what we then do is we press, and there it is. And it's quite fascinating the way you can deploy an implant into a pocket with no trauma.
And then once the first implant is inserted, we do exactly the same on the other side. So we insert the second implant. We connect it to our injector. And you see it's a completely closed system, which means there's no air or anything else touching the implant.
And we remove the second balloon. I get the injector. And like Marie said, we're not touching the implant. So this is truly no touch. We go through the channel, put it in. I'm putting my hand here just so it doesn't fly into the room. And then I press, and the next implant is in. And this is then followed by one stitch and glue. So there are no stitches to be removed. Basically the scars are glued, and you get a tape on, and you can take a shower after 3 days. That's it with the Mia. Let's move forward with the Preservé. So a lot of patients ask us, what's the difference really between MIA and Preservé? Well, first of all, both of them are tissue preserving procedures. MIA is performed through the axilla, Preservé through the IMF. Preservé is performed instead of with an injector. We insert the implant with a funnel. And both of them have ergonomic 2 implants. The difference is that the ergonomic 2 for Preservé doesn't have the same front and back side. It has a natural back side. So you want the implant with the back side on the fascia. Otherwise, the procedure is basically the same, preserving muscle, nerves, vessels. So we've got the implants, Ergo 2, we've got the infiltration for local anesthesia, we've got the channel separator, we've got the balloon for the pocket dissection, and then we've got the funnel for insertion. So Marie will demonstrate how we do this. So she starts off with the local anesthesia.
So again, the patient is awake, we are talking to the patient, and we start with the local anesthesia to the incision. And then, as you saw before with the MIA, we perform a local anesthesia. We put some local anesthesia into the lower pole, and then a bolus of local anesthesia behind the nipple areola complex, creating already with the fluid the future pocket, so the patient doesn't have pain and that we already have a small space. Then, as you saw before, we use the channel separator to make a 2 centimeter in diameter channel on the chest muscle below the gland, and this is to give space for the balloon. And the balloon again allows us, we insert it can be folded together, and this balloon allows us to create a blunt pocket exactly where we want to have it. And we have 2 balloons again, as you saw in the MIA procedure, and that allows us that this balloon takes care of creating the space, and on the other side also taking care that there won't be any bleeding. And once this is done, I can remove the balloon and insert the implant, this time with a so-called funnel that allows us to insert the implants through very small incisions. And this is essentially done by just slowly putting them inside, and then the implant will be put into the pocket. And we do exactly then a mirror reflection on the other side, removing first the balloon and then putting in the implant.
And since she's asymmetric, she's receiving 2 different implants, as you can see.
And then putting, with this little bag, the implant inside, allowing me minimal incisions. And also Preservé allows me bigger sizes than MIA. And then I just need to suture it. The patient is awake, she just leaves, walks out of the operating theater and gets her compression bra.
And one of the big differences really between MIA, going through the axilla, and Preservé is, with MIA, the perfect patients are those who have beautiful breasts, good tissue coverage, where you don't need to address asymmetries, which some patients might have in their IMF fold, or to correct some minor differences. What Preservé does, it allows precisely for that. You can correct it with your finger blunt. So not just going with larger implants, but also correcting a certain type of asymmetries is possible with Preservé. And today, I do believe that 95% of our procedures are done under local anesthesia with tissue preservation, which is a dogmatic shift in our practice for the last couple of years.
And I think now it would be very, very interesting for you guys to see how an actual patient thought that this experience, how this experience was for her. And therefore we would love to show you now one of our wonderful testimonials who underwent this MIA harmonization with us. And let's hear how her point of view, her side of the story is.
Naomi, Welcome.
Thank you.
Before we dive into your journey, tell us about yourself. What do you do for work and what are your passions outside of work?
So my name is Naomi and I'm 31 years old. I am an HR professional and what I like to do, hang out with friends, eat really good food, and I have a passion for samba, so I dance samba when I'm free.
Take us back to when you first started seriously considering breast enhancement. What was going on in your life and how long had this been on your mind?
Ooh, such a good question. I think, when I was younger, I really didn't think about any breast augmentation. But the older I got, I felt like I was missing that part, more to feel more feminine. So I think maybe when I became 17 years old, that's when the thoughts started to come.
Let's be honest. What were your biggest fears? You've been open about your concerns with scarring as a Black woman. Can you talk about why this was such a significant concern for you?
Because when I was younger, I was super active. So I have a lot of scars on my legs, and I know that they're not really disappearing. So when it came to my breast, and obviously it's a part where you show if you're in a bikini or have like cleavage or something like that. So I really wanted not to have any scars, and it can look very visible on dark skin. So that was my main concern, and obviously I wanted to be as unnoticeable as possible and such natural results, and that includes no scarring.
What made you choose Victoriakliniken? Walk us through your research process and the moment when you knew this is the place.
I think I was at work having lunch, and I was just scrolling to my fake Instagram account, and I just saw, I think, an ad popping through, and I immediately called my sister. I was like, okay, I need to do this. I found it. She's like, what are you talking about? So I found a place where I can do my breast, and I talked to her about the Mia.
Let's talk about the surgery day. What was the atmosphere like and what surprised you the most?
Honestly, I've talked about this to my sisters so many times. It was actually one of the best days of that year, I think, last year. It was we had a wonderful welcoming. The surgeons were amazing, and I was a bit nervous, but as soon as I stepped into the clinic, everything disappeared because I knew at the end of the day I will have my new breast and I'll feel amazing.
Can you describe the first week of recovery?
So the procedure took approximately 90 minutes. And my sister was waiting outside the clinic. So after the procedure, we went to town and I purchased new sunglasses and everything was like normal. And that week, I really didn't feel like I have done anything. It was just a bit of pressure, but nothing that hurt.
What about the scarring were you so concerned about? How has that healed and what did the doctors do to optimize that for your skin tone?
Obviously, after booking the procedure and the date coming up, I had consultation with my surgeon, and she was so knowledgeable about Black skin, and she told me what to do. First thing was to have the plaster on for longer than normal, and that really helped. And honestly, I don't have any scarrings. Me and my sister and my friends, we were always like, okay, should we try to see the scars today? But we cannot see it. We cannot see the scar.
How do you feel in your body now compared to before? What's different beyond just the physical?
Beyond the physical. I think I don't think a lot about how to dress or anything like that. I just put whatever I want to wear, to be honest, and maybe more confident.
Remember those activities and passions you mentioned earlier? How has this changed your experience with fashion, fitness, or samba dancing?
I think the biggest impact or change is when I go to the gym, because I had so many gym tops that before I had like a bra underneath the sport bra, but now I don't have any because the breasts are already lifted. So that's like, I feel good when I'm training.
Tell us about a recent moment where you felt absolutely amazing in your body. What were you doing and what made it special?
Maybe, I went to a birthday dinner last week and I had a dress on and you could see the breasts, and I got so many compliments on it, and I felt so good that, because before I couldn't wear it, or you could, but it wasn't as nice as it is now.
What would you say to another woman of color who has a similar concerns about scarring and is sitting on the fence right now about doing Mia?
Do it. Do it. I really wanted to also do this procedure to see how the scarring would be, and I think like it's a perfect opportunity for women of color to have bigger breasts and with minimal scarring or no scarring at all, to be honest.
What do you wish you had known beforehand that would have made the journey easier? Any advice for the women watching?
To be honest, I feel like it was a lot of information on the website about the procedure, and I watched a lot of videos and how the procedure is done. The only thing I can say is that I'm super happy that I waited to do any breast augmentation, because I don't know if I would have been as satisfied as I am with the Mia procedure.
Knowing everything you know now, would you do it again? And is there anything else you want women watching to know about the experience at Victoriakliniken?
Of course, I will do it again. Yes, that my surgeon is very, very, very knowledgeable, and I'm super happy that I got to work with her, and she took me through this whole experience. I'm just so satisfied with my results.
So Marie, who's really the ideal candidate for tissue preservation?
So we can say in general that the ideal patient is a patient who is satisfied with her breasts and she just would like to enhance them, harmonize them with her body proportions. And she likes to do a tissue preservation procedure, so it matters to her to perform this procedure in local anesthesia. She should have enough own tissue. We always say that you should have at least a 2 centimeter pinch. But then, of course, there are a little bit differences between Mia and Preservé, and maybe you would like to discuss that a little bit.
Yeah, what's interesting is that our traditional patients, looking at the data, going back 25 years, they rate their breast on a scale from 1 to 10, a 3. So a 3 before surgery. And then after surgery, 6 months later, they rate them about 8.9. The Preservé patients, they rate themselves around 4 to 5. Mm-hmm. And after 6 months, they are approximately 9.2 to 9.4. The Mia patients, they are 5 and above. Mm-hmm, and after 6 months, they rate themselves 9.8. So the Mia patients are really the most satisfied ones. And why is that? Why? Because the Mia patients are really the ones who never even considered having a breast augmentation, because they really have beautiful breasts from the very beginning. But now the fact is that we can provide them an enhancement under local anesthesia with fast recovery, so they think, okay, that's interesting, I can throw the push-up bra. However, the Preservé patients very often are patients that come in for breast enlargement, breast augmentation, and they want to go a little bit bigger, and they have asymmetries that we can adjust, although we're doing it under local anesthesia. And they might have slightly ptotic breast in the way that they need a small pexy, etc. Mm-hmm. So 2 different types, but the ideal ones, and I think we agree on this, is women who already have beautiful breasts, they just want to go a little bit more beautiful.
Okay, so we can say essentially the Mia is for all women who are actually super satisfied with their breasts. They go in and out with the same breast, just a little bit bigger. The Preservé is a bit more for tricky cases. Even if there's some degree of asymmetry, they might want to go a little bit wider or a little bit bigger. So who is the right candidate then still for classic augmentation?
So, you know, if you don't have enough tissue coverage, obviously if you put an implant, prepectoral, subglandular, although it's a very soft implant, over time there might be implant visibility. Mm-hmm. And even what we call rippling, that you might feel and see the implant. You don't want that. Now, those thin patients, they can have something that we call hybrid. We can combine the implant with fat transfers. However, if you're very thin and you don't have enough tissue coverage, you don't want to have a second procedure or another procedure at the same time, they're ideal candidates to go under the muscle to have enough tissue coverage.
Okay.
Those are really the perfect candidates for those ones. Please share with the audience how you perform the consultation and how your practice, especially as a female surgeon, has changed being able to provide tissue preservation.
So 95% of all my patients that come for a consultation for breast augmentation come today actually for Mia. So when they come, they fill out all the information about their health, and then we sit down and we in general talk about implants associated risk, because I think it's important to know everything about implants before putting some in. And then what we do is that we do some measurements, because it's very important to know exactly who is in front of you, how's the pinch, are the distances, so can I really can guide my patient through the whole process.
And that's how we collect data also, to see what happens over a long time.
Exactly. So we write everything down, we measure everything, and we write it down each time we meet our patients, because at Victoriakliniken we have a 10-year follow-up program. We see our patients after 6 months, 2 years, 4 years, 6 years, 8 years, and 10 years after surgery. And this way we have very good control over what happens over time with the tissues and with the implants.
And that includes ultrasound?
And that includes also ultrasound, so we actually know what's going on with the implant. Does it lay in place? Is it exactly as it should be? Is there a rupture or anything else? And then when we have this consultation, we even do sizing, so we test with the patient's implants that that might be suitable for her, so we get also a feeling for the patient. And then we have even a 3D machine, which means we do a 3D picture and the patient gets an idea how she's going to look like after the surgery. And I think that is very powerful, because one thing is to feel it, but another thing is to see it. And then our patients get a lot of information, so they go home, because it's an overload of information after consultations, and they can read through it. And usually we like to see them one more time to really finalize our plan for surgery with them.
Yeah, if they have any concerns. But now I know that you ask your patients, and I do so, is to bring photos of what they expect, what they want. Or for instance, mothers who breastfed, they say, I like the breast I had when I was breastfeeding. So bring photos, and we always encourage patients to bring that. And we also encourage them to bring a friend, because during a consultation, maybe you're a little bit nervous and some of the information gets lost, and with that some of the messaging. So we always encourage them to bring a friend or two to be there, and then they can discuss that afterwards. So we're very open to that. And in general, most of them are quite well informed after the first, but if they want to come back for a second visit, they're more than welcome. Because we both believe, and all of us believe, that you need to be really well informed about everything around this procedure.
Yeah, the well-informed patient, I think, is the best patient, because we meet our patients every other year after surgery, and I want to have a happy patient coming every other year back to me. And I think that's very important to all of us.
And we have guarantees. So that's also part of the protocol. So if anything occurs, any type of complication, we will reoperate them for free within the first 5 years. And that includes capsule formation, seromas, infections, bleedings, whatever could occur. Now, with that said, we all agree on that our responsibility with our patient doesn't end with the last stitch at the surgery. That's when it starts for the rest of their lives. And now let's go ahead with our last segment. Let's open questions from the public.
Thank you very much, everyone, for joining our digital event. And now I would love to go through some questions that we got from our viewers.
First question, I'm worried about visible implant wrinkling. What is the risk of this with the new Mia Femtech implants compared to traditional methods in implants?
So when we think about tissue preservation, breast augmentation, if it's Mia or Preservé, then the risk is very low for implant wrinkling or visible rippling through the skin. And the reason is because the design of these new implants is very different from the design of traditional implants. They are more ergonomic, so they follow the women's movement, and therefore it's very difficult to get any visible sign through the skin. But of course it is possible, so it's very important that the patients have enough tissue thickness on top of the implant, and we recommend at least to have 2 centimeter own tissue on top of the implant. So over time, also after 4 or 6 years, that the implant edges won't be visible through the skin.
Next question. If I'm a borderline candidate for Mia, what are the factors that are going to determine your recommendation for what procedure I should have?
So the magic with these different procedures, so for tissue preservation breast augmentation Mia, we use the B-convex Mia implant that is essentially no anterior or posterior side. It's B-convex, looks like a little diamond. This implant gives a lot of projection, but is limited to 8 to 10 centimeter in width. So it gives projection, but not so much width. So it's for every woman that has essentially super beautiful breasts. She loves her breasts, she loves her cleavage, she loves her side boob, and the only thing she would like to add is a little bit of projection. But some patients actually, especially after breastfeeding and childbirth, lack the width. So they lack in total the tissue. And then sometimes the Mia can look a little bit like 2 balls on the chest wall. And in these cases, we have a beautiful alternative, which is Preservé. It's the same gel, it's the same shell, so it's an Ergonomics 2 implant, but it's traditional designed. So it is a convex anterior side, but a completely flat posterior side. So they are flatter and wider, and they are perfect for patients that, for example, are not suitable for Mia, but they need a little bit wider, flatter implant. Again, these patients then will gain and get a very beautiful natural result, but they need sufficient coverage on top of the implant so the edges won't be visible over time.
All right, we have another question. I'm worried about capsular contracture. Are there differences in the risks of this between the Mia and Preservé?
So in general, in this tissue preservation breast augmentation techniques, we use the Motiva implants. The Motiva implants are now since 15 years on the market. And in all the studies that we have done within the last 15 years, we saw that the capsular contracture rate with these implants is extremely low, less than 1%. And the beauty is that this is also valid over time. We did now 2 big studies, one a Mia study and one a Preservé study with over 300 patients each. And what we saw is that the capsular contracture rate is less than 1% in both techniques, so there's no difference.
All right, next question here. I'm a patient who is over 40 and my skin is showing some signs of aging. How does skin quality and elasticity affect outcomes with Mia compared to Preservé?
So in both techniques, it's extremely important that we have sufficient skin quality and thickness on top of the implant. The worse the skin quality, the thinner the skin, the less it is possible to put the implant on top of the muscle. And here it doesn't matter if it's Mia or Preservé. We need sufficient coverage because we don't want the implant to be visible through the skin over time. But if the patient has sufficient pinch, like of 2 centimeter, then even with a little bit less good quality skin, we can put these implants safely on the muscle as long as the patient doesn't have a wish for extremely big implants. Because extremely big implants also have a big effect on the skin and skin quality because they will press down the skin over time. But within Mia and Preservé, usually our patients wish for a beautiful breast enhancement, and then this is a beautiful alternative that will be stable and beautiful over time.
All right, another question. How is diagnostic imaging like a mammogram or an ultrasound affected if I have this procedure? What should I be aware of?
So first of all, what is important to know is that implants are tested for 600 kilo. So the mammogram, the pressing of the mammogram won't destroy your implant. So you don't have to be afraid that it will get destroyed during the mammogram. And then what is also very important is that you inform your radiologist that you have breast implants, because then he will make sure to take 2 extra pictures, the implant pictures, to make sure that he really sees perfectly all the aspects of the gland. If there are any questions left, always an ultrasound can be performed afterwards, and it is even possible to do an MRI if, let's say, there's some questions open about a finding.
All right, a couple questions here. So pregnancy and breastfeeding, so I'll put them together in one. How does previous pregnancy, breastfeeding, or weight fluctuation influence whether someone is good for Mia or Preservé?
So again, with the Mia and the Preservé, the big difference is that The Mia is perfect for everyone that is very satisfied with her breasts, but she just would like to give them a little bit more projection. It's essentially like a push-up bra, but otherwise the patient is super satisfied with the cleavage and the side boob. In Preservé, we have also the chance to give the patients more width, and if they wish, to correct the symmetries, because this is where we are a little bit limited with the Mia. In general, I think both procedures are perfect for post-pregnancy patients because they give a very beautiful enhancement and give often the volume back to the women that they lost during childbirth and breastfeeding.
Okay, a couple more questions. I have asymmetries. What method do you recommend for someone like me that has asymmetries?
So in general, I would say that the Mia, we are a little bit limited with the correction of asymmetries. Why? Because we have the access through the armpits and the implants are just 8 to 10 centimeter in width. So the difference between the implant sizes is a little bit limited in width and also projection when it comes to asymmetries. Often our patients have asymmetry in the IMF fold, like how deep one breast sits, and also size-wise. The Preservé allows us here to play a bit more around. With the Preservé, I can first of all align the breasts on the same height. I can use 2 different sizes, 30-60 cc difference, to work with volume asymmetries, which is not possible within the Mia range. And this is why I think that the Preservé is more suitable for patients that have stronger symmetries.
All right, last question that we have time for today. How much of the final result is determined by a surgical technique versus my own anatomy?
Both of it is very important, but I would say that the key component is that your surgeon finds for you the right implant for the right reasons for the right patient, and then you will get a beautiful result, even if your biological features are not the best. And I would say that is the key. Of course, it depends then on the biological features, how good the healing and the final result is, but I would still say that the surgeon is the key component to guide here the patient to the right result. Thank you very much for joining our digital event, and please reach out to us if you have any further questions.